Hello everyone, you're welcome to Mom Health Parenting YouTube channel, and I am Dr. Aderemi for Mom Health Limited. We're going to be talking about something really interesting and something very common. We're going to be talking about nausea in pregnancy, how to deal with it, how to cope with it. Nausea, as we all know, is a very common symptom in pregnancy. It's a giveaway usually. Once you start telling your friends, oh, I feel like vomiting, I feel like throwing up, or you begin to stand up from your seat at work, begin to run to the bathroom, you want to puke, you want to throw up. This is something really common in pregnancy, especially the first few weeks. So what is nausea? Let's talk about what is nausea. It's a feeling of uneasiness, queasiness. Some women describe it as my chest is tight, I have a feeling of indigestion, followed by an urge to throw up, an urge to vomit. It is very common, and I'm sure that every one of us at one point in our lives, even if we're pregnant, have experienced this. So nausea, what causes nausea in pregnancy? Usually it's caused by a rise in an hormone we call HCG. When you go into the bathroom and you find out, oh, there are two lines, your urine strip has two lines, that kit is testing for human chorionic gonadotropin. It's an hormone that your body begins to produce once you get pregnant. And once you see those two lines after a urine test and you're like, oh, I'm pregnant, you're so excited, you're expecting a miracle, that hormone begins to rise. It's an hormone that rises through your pregnancy. It's an hormone necessary for pregnancy to be sustained. So it is very related, or research has found HCG rise to be associated with nausea in pregnancy. Another thing is your hormones, they fluctuate. Pregnancy causes a lot of things. That's why it's usually an emotional roller coaster. Pregnancy, as beautiful as it is, has its own perks, has its own problems. And at a point, some women claim, I'm tired, I just want this baby to come. The reason for this is hormone fluctuation. Estrogen, progesterone, these hormones fluctuate when a woman is expecting a miracle, and this can cause nausea. Another thing that can cause nausea is stress. You are not resting, you are tired, you are not eating well. This can also trigger nausea. Another thing that causes nausea in pregnancy is offensive smell. Some women, once they smell a certain perfume, certain detergent, a certain air freshener, they begin to complain, oh, I'm nauseous. Some women can't even cook when they are pregnant. Some women can't go out. Some women can't use deodorants. Some women would even tell their husbands, oh, I can smell you and it's making me nauseous. Some women will smell their neighbor's food, their neighbor's clothes. It's usually an exaggeration of an heightened sense of smell during pregnancy, and this can trigger nausea in pregnancy. As I said earlier, nausea in pregnancy is very common. It's a giveaway. Most women, when they're expecting, it's an early sign, oh, I'm feeling nauseous. Should I do a pregnancy test? Should I check if I'm pregnant? So nausea is very common. It usually comes up between week 6. Around week 6, some women don't even know they've missed their period, week 6 to week 12. It usually peaks around week 9. But trust me, it could be really sad for some women. Some women could go through the second trimester. Some women will go through this third trimester. Some women will still have nausea up until the time the baby is pushed out. So it's different from every woman. Every woman has a different pregnancy experience. But most women, at a point or the other during pregnancy, will complain of nausea. So how do we deal with this common symptom? First of all, we're happy, we're expecting. So have a very calm mind. Just know the nausea is a sign that, oh, something is about to happen, you're about to get bigger, the whole world's about to know you are expecting something. So it's a function of your mind, oh, I'm nauseous, and it's normal. It's a normal pregnancy symptom. It's a sign your pregnancy is progressing well. It's a sign your body is responding to this new miracle. So it's important for you to remain calm. It's important for you to identify with the symptom. It's important for you to know it's normal, and it's a phase that will soon pass. After that, we should avoid triggers. If your husband's perfume is making you want to puke, if a certain toothpaste, a lot of women will say, oh, I can't use this certain toothpaste when I'm pregnant, I can't brush my teeth when I'm pregnant, change your toothpaste. If the toothpaste is not working for you, use mouthwash. I had a patient of mine that wouldn't brush in the morning, she would brush in the evening. Usually, nausea, it's not specific to any time of the day, morning, afternoon, night, but a lot of women complain that it's worse in the mornings. It depends on your body. If you can't brush in the morning, rinse your mouth, use a mouthwash. In the evening, take careful time to treat your mouth, to treat your gum. These are ways you can personalize your nausea management. You know your body, you study your body. If a certain detergent is not working for your clothes anymore, if you are beginning to smell it on your clothes, change it. Any offensive smell. If you don't want to cook, don't cook. Get food from elsewhere. Anything, pamper yourself, enjoy yourself, take time out to rest, take time out to relax. When you wake up in the morning, just take your time before getting up from bed, because nausea is usually worse in the morning, usually because your stomach is empty. That's another thing. Avoid an empty stomach. Snack as often as possible. Take bland snacks. What I mean by bland snacks is nothing serious, nothing that will trigger anything, like crackers, biscuits, something dry, something you don't have to smell. Take anything that makes you comfortable. If you are thinking, oh, I can't eat this, you want to eat pepper, anything to avoid triggers. Because nausea can get unpleasant, can get uncomfortable. So if you find anything that works for you, simply do you. And simply try to enjoy this beautiful time as much as possible. Another thing we can do to cope with nausea is you can try out certain things. What I mean by certain things are like peppermint. If you realize that chewing gum that has peppermint helps you, you can try this. Some women have swore by ginger. Some women claim they can chew onions. Some women even claim they can take salt, they can lick salt. Some women claim tom-tom, lemon fresh, anything that works for you. Just try something minty. If it's working for you, go to work, you chew it, and everybody's asking, why are you chewing gum? You're like, I'm just chewing it. I just feel like chewing it. And if you're ready to share your news, you share your news. Oh, I'm nauseous, I'm expecting. All these are coping mechanisms any woman can adopt. If they are not working, then please come and see us. There are certain medications that are safe in pregnancy. They are few, and we have to check other symptoms. That's why I won't recommend you starting any medication at home. If all these remedies are not working, the nausea is exaggerated, you cannot function, you're vomiting several times, you can't keep any fluid down, you are tired, you are disoriented, you are dehydrated. Some women, when they're expecting multiples, their HCG levels are really high. They have a condition we call hyperemesis gravidarum. They are vomiting, their electrolytes are deranged, they are dehydrated. This kind of women, we need to admit, we need to rehydrate, we need to stop the vomiting so they can continue with their lives, as well as for the health of the mother and the baby. So if you're having exaggerated symptoms, you can't do anything, please and please visit us. There are certain medications we can give. Another thing that could help you, please, is use your prenatal vitamins. When a woman is nauseous or vomiting, she might not feel like taking drugs. But anything that works for you, if it's capsule, if it's coated, if you have to wrap it in your swallow, if you have to use a certain juice to take it, please and please don't forget to take your prenatal vitamins. And don't forget, it's just for a short while. When you hold your baby, you forget you were ever nauseous. Have a lovely day. Thank you.
Thank you very much. Please don't forget to subscribe, don't forget to like, and don't forget to share this video. Also, hit the notification button to get more videos like this. You can also visit our website at www.momhealth.com.ng for all maternal and baby products. Guess what? We have a 10% discount for you for all purchases made on that website. Another good news we have for you is you can also visit Google Play Store and download the Mom Health mobile app to explore all our amazing features. Thank you very much.